I would like to introduce myself that I am staying in the middle of Indonesia. This is South Sulawesi, Makassar city, around 2 hours flight from the center of Indonesia, Jakarta. And then I'm working under the Ministry of Health of Indonesian Republic. At this time, I'm working as a professor associate in one of the nursing school in Indonesia under the Ministry of Health of Indonesian Republic. My presentation is talking about the innovations in cardiac nursing, evidence-based strategies for optimizing patients' outcomes in acute and critical care. The introductions of my study is like what you see there, that actually this presentation is summarizes a multi-center evaluations of evidence-based cardiac nursing strategies and of course their impact on clinical outcomes. It focuses on implementations, measure effects on length of stay, readmissions, adherence, and implications for practice and policy. What is the background and objective of my study? Actually, like we know that cardiovascular disease remain the leading cause of mortality worldwide, representing a major global health burden that continues to challenge healthcare systems across both developed and developing countries. According to the World Health Organization's 2022, approximately 17.9 million people die each year due to the cardiovascular conditions, accounting for nearly 32% of all global deaths. A significant proportion of these deaths occurs prematurely, particularly in low and middle income countries where access to timely and high quality healthcare services is often limited. The growing prevalence of cardiovascular conditions, including acute coronary syndromes, heart failures, arrhythmias, and hypertensive crises, underscores the urgent need for effective evidence-based clinical management strategies. What is the aim of my study and the scope of my study is that these are multi-center causal comparatives to the assessments nursing intervention across 8 type B hospitals between 2022 and 2025. In Indonesia, we have actually the type of the hospitals. That is type A is the highest type of the hospital, and then type B is the second type of hospitals. But the type B is provided all around the country in many municipalities, even in the city of the provincials in our country. The goal was to evaluate real worldwide effectiveness for the early mobilizations, pharmacological management, and giving the educations. The target of outcomes, actually, this is would like to understand the primary outcomes, length of stay, 30-day readmissions in hospitals, and treatment adherence. The secondary focus is implementation fidelity, feasibility across diverse hospital settings, and policy implications. What is the method and design that we are going to be used in our study? That the studies employed a causal comparative design to examine the relationship between evidence-based cardiac nursing interventions and patients' outcomes in acute and critical care setting. The causal comparative approach was selected because it allows for the investigations of associations between variables in real-world clinical environments without manipulations of independent variables. This design is particularly appropriate in healthcare settings. Unlike the randomized control trials, which requires the control over interventions allocations, sorry. And actually, the study was conducted across 8 type B hospitals in Indonesia between January 2022 and January 2025. And then a total of participants is around 140 patients were controlled in the study. The sample size was determined based on power analysis to ensure adequate statistical powers higher than or same 80% to detect moderate effect sizes in correlations and regressions analysis. The inclusion of multiple centers helps to increase sample heterogeneity, reduce selection bias, and improve the robustness of the findings. Patients were recruited from acute care units, including emergency departments, coronary care units, and intensive care units. These units were selected due to their high patients' acute and critical role of nursing interventions in patients' management. And then actually, what is the measurement tools? Just wait. This is actually data were collected from electronic medical records, forms, and validated questionnaires, iterated reliability, pilot testing, and centralized auto data quality and minimize missing failures. What is the interventions protocols? Actually, a standardized interventions protocol was developed based on current evidence-based guidelines. Based evidence-based guidelines in cardiac nursing and was implemented across all participating hospitals. Prior to the study, nurses received training to ensure consistent applications of the interventions. The first is the early mobilizations. The early mobilization was initiated within 24 until 48 hours after patients achieve hemodynamic stability as determined by clinical indicators such as stable blood pressures, heart rate, and oxygen saturations. The mobilization protocol consisted of progressive stages, passive range of motion exercises, sitting on the edge of the bed, and then standing with assistance, and then the last is ambulations within the room or corridor. Nurses assess patients' readiness for mobilizations using standardized criteria and monitor for the adverse events such as dizziness, arrhythmias, or hemodynamic instability. The goal of early mobilizations was to enhance functional recovery, prevent complications, and reduce length of hospital stay. Over the pharmacological management focus on optimizing medications adherence and ensuring safe administrations of prescribed therapies. Nurses were responsible for monitoring medications administration schedules, assessing therapeutic effectiveness, identifying and managing adverse drug reactions, and then providing patients counseling on medications use. How about the patient's educations? Structure-based education was delivered through individualized and group sessions. Educational contents include medications adherence and side effects, dietary recommendations, for example, is low sodiums, healthy diet, and then physical activity guidelines, smoking cessations, and then recognitions of early warning signs, for example, is chest pains and dyspnea. Educational materials were standardized across sites as include brochures, visual aids, and verbal counseling. Education sessions were conducted at multiple time points, including during hospitalizations and prior to discharge. What is the result of the study, actually? The result of the study at the first is demographic and clinical characteristic of participants. A total of 140 patients met the inclusion criteria and were included in the final analysis. The demographic and clinical characteristic of participants are that, sorry, actually I must put it here, but I didn't put it in at the tables in my presentations. The mean age of participants was 58.4 years with the standard deviations plus minus 11.7, indicating that the majority of the patients were within the middle age to older adult populations, which is consistent with the epidemiological profile of the cardiovascular disease. The age distribution showed that 65% of participants were aged more than 50, 55 years old, reflecting a higher burden of cardiac conditions among older adults. How about the evidence-based nursing intervention and patients' outcomes? The implementations of evidence-based cardiac nursing interventions demonstrated significant improvements across multiple outcomes measures, actually. The early mobilizations was associated with a statistical significant reductions in length of hospital stays. Patients who receive early mobilizations within 24 to 48 hours experience an average reductions of length of stays in approximately 20% compared to those with delayed mobilizations, P 0.01. This finding suggested that early mobilizations plays a critical role in accelerated recovery and reducing hospitalization times. Pharmacological adherence was another key factor influencing patient outcomes. Patients who demonstrated high adherence to prescribed medication had a 15% slower day of readmissions within 30 days, P 0.03. Sorry. How about the correlations analysis between interventions and outcomes? For further explores the relationship between nursing intervention and patient outcomes, presence correlation analysis actually was conducted. A strong positive correlation was observed between the implementation of integrated nursing interventions and overall patient's outcomes are 0.68 and P lower than 0.001. This indicates that higher levels of intervention implementation were associated with better patient outcomes. Specifically, patients' education showed that strongest correlations with treatment adherence are 0.72, followed by pharmacological adherence 0.64, and early mobilizations are 0.59. This finding suggests that while all interventions contribute to improve outcomes, patients' education plays a particularly significant role. How about the regressions analysis and predictors of patients' outcomes? The multi-force regressions analysis was conducted to identify the strongest predictors of patients' outcomes. Patient education was identified as the strongest predictors of treatment adherence. Alpha is 0.41 and P is 0.002, followed by pharmacological adherence. Alpha is 0.33 and Phi is 0.001. Early mobilization was the strongest predictors of reduced length of stays is Phi 0.01. And then, what is the practice and policy recommendations actually? Practice and policy recommendations is actually the studies provides robust empirical evidence supporting the effectiveness of integrated evidence-based cardiac nursing interventions in improving patients' outcomes within acute and critical care setting by examining the combined effect of early mobilizations, pharmacological adherence, and structured patients' educations across multiple hospitals, This study extends the existing body of knowledge beyond single interventions or single center analysis. These findings not only confirms the individual's benefits of these interventions, but also highlight the synergistic impact when implemented as part of a coordinated care strategy. One of the most significant findings of the study is reductions of the length of hospital stay associated with early mobilizations. Patients who underwent mobilizations within 24 to 48 hours of hemodynamic stabilization experienced a statistical significant decrease in length of stay, consistent with the previous research demonstrated the clinical and functional benefits of early activity in critically ill patients. Early mobilization has been shown to improve cardiovascular efficiency, enhance muscle strength, and reduce the risk of complications such as venous thromboembolisms and pulmonary infections. The findings of this study reinforce those reported by scholars 2016, who demonstrated that early goal-directed mobilization in ICU setting lead to improved functional outcomes and shorter hospitalizations. What is the conclusions of my study? Evidence-based cardiac nursing interventions have demonstrated a substantial and clinically meaningful impact on improving patients' outcomes, particularly within acute and critical care setting. The finding of the study reinforced the growing body of evidence that structures evidence-informed nursing practice are not only effective in enhancing the quality of care, but also play a pivotal role in optimizing measurable clinical outcomes, specifically the implementations of integrated interventions such as early mobilizations, pharmacological management, and structures patients' outcomes, was associated with a significant reductions in length of hospital stay, decreased readmission rates, and improved treatment adherence among patients with acute cardiac conditions. The standards protocols, nurse training, and implementations monitoring actually to sustain the benefit and support systems level of policy adoptions. Okay, thank you.